The cost of U.S. healthcare has been steadily increasing, and it sounds like it's not done yet. The Centers for Medicare and Medicaid Services says national health spending is projected to grow roughly 5.4% per year until it reaches nearly $6.2 trillion by 2028.
Yeah, this has led many Americans to seek more affordable alternatives abroad even. WCNC Charlotte's Jane Monreal shows us the increasing trend of medical tourism and what you want to look out for so you're not left asking where's the money.
One thing behind the growth of medical tourism is a backlog of delayed medical treatments during the pandemic. Now more patients, including ones from North Carolina, are willing to go international for elective procedures. So where are patients traveling to? The CDC lists Mexico, India, Singapore, and Costa Rica as popular destinations for treatments covering anything from cancer to fertility. According to the executive director of the Costa Rican Chamber of Health, Massimo Manzi, he said that North Carolina is among the states with the highest number of visitors to Costa Rica for medical reasons. The organization estimates nearly 70,000 international patients the country receives. Out of that number, 83% are from the U.S. And out of that amount, 10 to 15% are from the Tar Heel state. Medical tourism in Costa Rica now a $465 million a year industry. That's more than its coffee exports, which generates around $300 million per year. I talked to Dr. Eugenio Brenes, who received his education and training in California, then decided to move his dental practice to Costa Rica in 2007. He says more and more international patients make the trip to his home country, especially when substantial work needs to be done.
A tooth aches and then they go to a dentist and it's not only one tooth, it's maybe 5, 7, a tooth that is need to be removed, having an implant placed, having a couple of crowns redo. Patients, they being hit with $30, $50, $60,000 treatment plans, which they cannot afford.
Dr. Brenes says the savings adds up quickly. For example, a ceramic crown at his practice in the U.S. 15 years ago would run about $3,000.
The same crown by the same practitioner on a similar environment. The only thing is that we are in Costa Rica, not in Pasadena. The same crown is $550.
He says his facility uses the same modern-day technology as American doctors. So how can they charge less? Dr. Brenes says they save on rent of their building, which they pass along to the patient. When it comes to feeling safe when choosing to go abroad for medical treatment, Dr. Brenes says it's crucial to do your research, including looking for practitioners with U.S. or international training and accreditation.
And if you have a gut feeling that it's not the one for you, don't go there.
The Costa Rican Chamber of Health tells WCNC Charlotte that in December of 2022, a medical tourism law was approved establishing medical tourism as a public policy, which has several key implications for international patients. They include enhanced quality assurance, consumer protection, and development of infrastructure and other services to support medical tourism. Back to you.